To Go Local Live, I'm Josh Fenton, CEO and co-founder. Let's jump right to it. A, beautiful day outside. Second, I want to thank Professor Jim Tull from Providence College. He was on earlier today with news editor Kate Nagel. It was a great interview. If you haven't seen it, delve into it. We'll have much more on it. Minimum wage has been upped. Over the next 4 years, it'll go to $15, but it still trails Massachusetts significantly. They're already at $13.50. We don't get to $13.50 as a state for another 2 years. Earlier this week, Bank of America, which employs a lot of tellers and things like that, job functions that are on the lower end of the pay level, announced that they were going to $25 as a minimum hourly compensation. So Rhode Island is going up, but we're still trailing some of our bordering states and what some of the leading companies in the country are doing to try and get people a more livable wage. Let's go to Dr. Michael Fine. He's the former director of health. He joins us, 300 times in the last 14 months, I think somewhere around there, 200, 300 times. Dr. Fine, thank you so much.
Always good to be with you, Josh.
Okay, let's go to the numbers. The numbers by the Department of Health have been a little squirrely. We didn't have numbers yesterday. We do have numbers today. But overall, the numbers are much improved over the past few months. Let's talk about them. Walk us through the numbers.
Sure, we're making good progress, even great progress. For me, the big number is that we're down to 71 people in the hospital with 17 in the intensive care unit and 13 on a ventilator. That's way better than we've been, and the trend is really positive. That's something to celebrate. The number of new positives continues to be relatively down, but I can't tell what that means because the amount of testing we're doing has dropped off as well. Wonderfully, the number of deaths have really dropped. We had no deaths in the last 24 hours and only a few in the last week. That's something to celebrate. And we've done an amazing job getting people vaccinated. The vaccination has gone up. We're now about 63% of the population has had one vaccine at least. And that number continues to grow as we vaccinate 12 to 15-year-olds and people in high school. It doesn't mean that we don't see resistance, but we're moving along. We just got to get ourselves to 80 or 85%. And that last 5 or 10% is going to be the really big challenge as we go forward. So overall, we're doing great, and I hope we continue to do great. I also hope that we don't rest on our laurels like we did last summer and assume that because we're not seeing positives in the summer that the disease has gone away. All the evidence says that's not true, and we really need to keep our eye on this ball and work even harder to make sure we get this disease stamped out.
Yeah, listen, it's good news across the board. Almost every indicator is looking more positive than it was 4 weeks ago, 6 weeks ago, 8 weeks ago. But obviously, there's still a fair amount of disease. Last year, the Raimondo administration started taking victory laps and calling all the national press, and that blew up on them when we saw more than 1,000 people die in November, December, and January. But let's go back to the seasonality of this. This is the tease, right? We've seen it before. It's absolutely critical that continue to push for vaccination because the combination of vaccinations at a higher percentage going into the fall is an absolute must.
Yeah, well, that's, I think we have blunted the disease progression in the spring, and we're going to see a quicker drop this spring than we did last spring due to the vaccine. And if we want to make sure we don't see a fall surge again, we got to get to 80 to 90% vaccinated. And that's where we really need to roll up our sleeves. At the same time, we need to double or triple our surveillance, particularly in communities that have been hard hit. So we begin to test so that we continue to test and test and test and test and test again. Those places where we've seen hotspots of disease until we see no disease at all for a month or two at a time.
Let's go to Let's put the good news aside for a moment, and that there is a little worry blip on one of the variants coming out of Brazil. Talk about that variant, its growth in Rhode Island, and what the very concerning element of it is and risk to Rhode Islanders and especially to children.
Sure. Well, both the P1 and P2 variants from Brazil are spreading and spreading here. I think we've seen over 100 measured or tested P1s in Rhode Island, and that's a little troubling because there have been many more kids infected and kids dying in Brazil. Now, there's an argument that's going on in the scientific community about whether that's from the variant or whether that's from access to medical care in Brazil. But Brazil is actually a pretty sophisticated country medically, and they may have access issues for sure. But I think we got to keep our eye on that variant as the cause of those deaths in kids and the very severe disease that's occurring in pregnant women. So we've got to be watching this and continue to try to drill down till we get almost no disease spread in Rhode Island, because that's the way we'll keep P1 from hurting us here.
Yeah, early indicators, a little bit of a danger zone there. India continues to be ravaged, and the impacts of it are just gruesome. The descriptions of bodies floating in the Ganges River is just heartbreaking and stomach turning simultaneously. There's literally no place to dispose of bodies right now, and this virus is not diminishing in any significant level there, but the deaths are just piling up.
Yeah, and I am hoping that the world community continues to deliver vaccine there. India has been a not very well vaccinated country until recently, but I also don't think we understand the population dynamics. We don't understand why the virus sort of didn't spread much in India until about 4 or 5 weeks ago, and then exploded. That's I have this belief that there's some other cofactor that influences disease spread that we haven't identified and understood. Until we've got that nailed down scientifically, everybody's got to be careful, because what's happened in India could happen here the way it happened in New York and Rhode Island last fall and then the spring of 2020.
Yeah, a data point for caution for all of us. It brings the question, here's a variant, it's been measured in Rhode Island, and not insignificantly. We've only done DNA sequencing for less than 3,000, and 100 of them are tied to these Brazilian variants, I believe, right around 100. What should parents be doing? What should pregnant women be doing?
Everybody should be getting vaccinated. It's as simple as that. Parents should be vaccinated themselves and vaccinating their kids as soon as vaccine is available to kids of their ages. We're down to 12, so we ought to be getting all the 12-year-olds vaccinated like yesterday. In fact, yesterday I spent the afternoon at a vaccination clinic for 12 to 15-year-olds in Central Falls. That's what we should all be doing, getting every single kid who's eligible for the vaccine vaccinated now. The Israeli data strongly suggests that the more people you vaccinate in a community, the slower the disease spreads in all parts of that community, including school kids. So, the more people we get vaccinated in each community, the more unlikely it becomes that our kids will get one of the Brazilian variants.
What should the state be doing right now? Testing is wildly inconsistent. It's never been more inconsistent. We have days of 2,000 tests and days of 14,000 tests, and there's no rhythm to it. It doesn't even match up with days of the week the way it used to. You know, it used to be Sundays were always slow. Now it could be a Tuesday and there's 2,000 tests.
Yeah, well, I would like to see us really organize and regimentize the testing so that, every business or organization, every school where we have people coming together, ought to be tested once or twice a week. And that needs to be done with rigor so that every single person involved gets tested regularly. To me, that's the thing that we should be doing in addition to really pushing on vaccination, as we're doing a great job with vaccination. I think we just need to keep our eye on the testing. And I'd also like to see us use more PCR testing and less rapid testing, and make sure that we double, triple, or quadruple the number of variants, the amount of DNA sequencing we're doing, so we know what variants are here and spreading before they get to be out of control.
Listen, I saw the number of DNA sequencing per capita, and I thought Rhode Island has to be the worst state in the country. We're actually not the worst state in the country. We're one of the better ones, and we've done almost no DNA sequencing. I mean, 3,000 since mid-December when the variants were first detected in the state. So it seems remarkably low, and it seems to be a place that you would want to invest in from a state standpoint to be able to have that early detection system. We seem to shun away from knowledge and utilize knowledge as power. We seem to want to wait till things explode, and then we're trying to play catch up and clean up.
Yeah, no, DNA sequencing is expensive and time consuming, and it
Sure.
means
Yes, 100%. Yes, and closing down businesses and people going into the hospital for 45 days on a ventilator. I bet you one person on a ventilator for 45 days costs more than a bunch of DNA sequence tests.
You and I are together on that. I mean, I understand where the problems are, but it doesn't mean I don't think we should be much more rigorous than we are now about both sequencing and testing, particularly in the densely populated parts of the state where I suspect the disease hung out last summer and will hang out this summer unless we really, sort of double or triple our efforts at testing and make sure that testing is happening regularly. We really need to be thinking about not just how you reduce the spread of the disease, but how you stamp it out. This is the moment when we ought to be focusing on not just reduction of spread, but on eradication, and have that as our goal.
Dr. Michael Fine, thank you so much. I always appreciate you taking the time. For everybody else, stay tuned. It is just rapid fire amount of news that has been coming out of the Ocean State over the past 10 days. It's just been an endless number of stories, and many of them complex, and many of them still developing, whether they are on the crime front or related to the Providence Public Schools or what's going up on the State House. It is getting to be the busy time up at the Rhode Island General Assembly. For everybody, get vaccinated. As I say every day, I just got cleared last Saturday. The difference is immense. I had lunch with two people I hadn't seen for years up on Federal Hill outside yesterday, and it was great to see them. It was remarkably refreshing and empowering, and just felt wonderful to see friends. Get vaccinated. It literally will change your life, and it will protect you and your family and your friends and your coworkers. Thanks, everybody.
Thanks, Josh.